What would you give up for health insurance? A bigger house? A nicer car? Our next story comes from two patients of Jericho Road Family Practice, a husband and wife who gave up both of those things and more to make ends meet. But when they sought out public assistance for health insurance, they were shocked at what else they were asked to give up.
The first time I saw her, I was with my buddy that I was stationed with, and the first words out of my mouth was that I was going to marry that girl.
He came in with a friend of his, and at first he couldn't say anything. He just kept staring at me, and I asked him if they wanted to drink, and he just kept staring.
She was the bartender at the bar that I was getting drunk at 7 nights a week. She saved me from becoming an alcoholic. My name's Alan Petrosky. I'm 51 years old and born here in Buffalo, New York.
My name is Kim Petrosky. I'm 59 years old. I was born in Watertown, New York.
I was going to Korea and we were going to have a rough time apart. Just wanted to tell her how I really felt. That was the first time when I told her that I loved her and everything was going to be all right and we'll get through it. And she was the one. We got married. I did my special ops training. I worked with SEAL teams and Marines and frontline stuff. I was with the 160th Special Ops. My back was destroyed. They told me I was going to be in a wheelchair by the time I was 50, and I'm 51, so knock on wood.
In the early 90s, when the military began a post-Gulf War downsizing, veterans like Alan were asked to retire early. Alan was given a choice between collecting his pension over the course of many years or receiving a lump sum immediately. He chose the lump sum so that he and Kim could put a down payment on a house. What he didn't realize was that taking the lump sum would compromise his ability to receive ongoing health benefits in the future. After Alan donated one of his kidneys to his son, his health began to deteriorate. He came to Jericho Road and was diagnosed with sarcoidosis, a disease that causes severe inflammation in the lymph nodes and other tissues.
I went from running on the battlefield to barely being able to push a vacuum, and it's a lot to swallow.
Alan's health problems prevented him from working, and he had to go on disability. To make matters worse, Kim developed health problems of her own. After a car accident and a bad fall, she was also unable to work. That's when the bills began to pile up.
Everything just got to be too much. And that's when the welfare caseworker said, well, if you divorce your husband.
Alan and Kim's monthly income was just $1 over the maximum allowance for state health insurance. If they divorced, their incomes would be separate, and Kim would be eligible for free public coverage.
Did I consider getting divorced? Well, to get Kim her insurance, yes. I mean, if she needs help. And the time comes where we can't hold off any longer. Where how am I going to pay for X-rays and how am I going to pay for surgeries and how are we going to do this? You know.
Kim refused to divorce her husband of 20 years. Their health problems haven't gone away, and they both live in constant pain. Kim is still uninsured and is still a patient of Dr. Glick. Without Jericho Road, divorce might have been Kim's only option. Despite all these challenges, Alan and Kim are sticking together.
So yeah, we've taken care of each other on a lot of different things. It's been that way for a long time. And we do the best we can, and always will.